started. That was just something to note. And I will tell you when we're live. And I'll take all questions from the chat, so you don't have to worry about looking at the chat.
Okay.
Make sure it's broadcasting. Well, hello, everyone. Another great evening here that Fayetteville PACT is currently hosting Black History Series 2022. We are sponsored by North Carolina Block. North Carolina Block is North Carolina Black Leaders Organized Collective here in North Carolina that believes in building a Black infrastructure. I will post their website in the chat. We will also ask you to put questions in the chat as well. But tonight is our last Black History Series, and we are honored to have Dr. Richard Watkins here with us to discuss where, as Black people, do we see ourselves after the pandemic. We thought we was going to get out of this 2 years ago. Didn't happen. We're still here. Let's see how this may look in the future. But I just want to make sure I introduce Mr. Dr. Watkins, because he is here on, and he kind of helped us out last minute to discuss this and have this very much discussion that's very informal about how the Black people may look. And the reason why he's here is because, one, he's a doctor, right? And I'll just read his bio a little bit and he can go emphasize a little bit of some things, but his bio is so long because, you know, this is what happens when we become doctors. So no offense. So Dr. Watkins was raised in Greensboro, North Carolina. He earned his PhD from the University of North Carolina at Chapel Hill in microbiology, immunology, and specialty in virology. His research focused on factors that influence disease progression towards AIDS and HIV infected patients. Prior to attending UNC, Dr. Watkins earned his bachelor's of science in psychology with a minor in sociology from Fayetteville State University. He played varsity football for Fayetteville State throughout his entire undergraduate experience. Dr. Watkins is the founder of and CEO of the Science Policy Action Network, Inc. This is what I find very interesting. Once again, the Science Policy Action Network, Inc., which is called SPAM, which was formed in 2014 to fill dangerous gaps between scientific advancement and stakeholders. SPAM envisions a scientific enterprise that grows and creates opportunities binding its society as well as success and prosperity as a whole. He is the president of the UNC chapter of Sigma Phi, the International Honor Society of Science and Engineer, and one of the oldest, which is one of the oldest and largest scientific organizations in the world. Members have been included from Nobel Peace Prize, such as Albert Einstein, Francis Crick, Enrico Fermi, Louis Pauling, and James Watson. Dr. Watkins is the first Black president of the UNC chapter of Sigma Phi. Committed to service, Dr. Watkins is also a member of the Rotary Club of Raleigh, where he serves as the director of the club administration. Rotary motto is service above self. Dr. Watkins also served on both the Religious Affairs Committee and the Health and Wellness Committee for Chapel Hill Charbo chapter of the NAACP. Dr. Watkins lived in Durham with his wife, which is also a doctor, Dr. Charity Watkins, assistant professor of social work at North Carolina Central University, and they have a 5-year-old daughter. His focus is definitely on scientific science of advanced medicine and our systems. Is that correct?
Yeah, that's right. You know, thank you so much. It is something sitting here listening to somebody read all those things, but truly honored. I have to put in a small edit. And if my daughter heard you do that introduction, she would have jumped in. February 15th, She turned 6 years old. So she once was 5, but now she is 6. And so super excited.
Hey, happy birthday. Happy birthday. My bad. You're 6 now, so get grown with it.
Yeah, so we might have to update the website. But yeah, that's new. But you're absolutely right, Kathy. I love science. It's a passion of mine ever since I was a little kid. And so, yeah, it's just great. And being able to be in this area made possible by my training at Fayetteville State. But now being in the Triangle, it provides me with so many different opportunities. And I'm so honored and humbled to be a servant and really bring science to a lot of different people. So yeah, we're very excited about that. And we've been quite busy during the pandemic. So yeah, just happy to be here and looking forward to the conversation.
Well, thank you, Dr. Watkins. And you got me as the moderator tonight, so I don't know which way this can go. But,
all right.
But it will be real. It will be real. So
Okay.
I noticed that you specialize. Well, first, I want to thank you for coming on our show. We do appreciate you taking time out. I believe we had a show with you before last year on COVID,
Yes.
with North Carolina Medicare for All, one of our partners. But I had a question for you that it's just something that we've been contemplating with between the CDC and the mandate this, mandate that, test not right, test is right. Where do you think the Black community will be after we're done with taking off our masks, not having COVID symptoms in the next, let's say, because it's going to take us about 15 years to recruit, but let's just say in about 3 years from now, where do you think that we will be when it comes to our immune system, since you specialize in that area?
Yeah. So I think the Black community is going to be like, a lot of other communities. I think we are going to have immunity in one way, shape, fashion, or form towards coronaviruses. Will it be sufficient for protecting us from the emergence of new coronaviruses? I'm not sure. That remains to be seen. But in 3 or 4 years, I imagine everybody will have immunity of some sort towards coronaviruses, whether it's through natural infection or whether it's through the vaccination. So that's where I think the Black community will be. But I will also say that if we are to do better at managing this pandemic, if we're still in it 3 years from now, or if we're dealing with new emerging infectious diseases. My hope is that we will play a larger part in the response and preparation for these pandemics. So, Kathy, I really just have to say that I think one of our biggest issues here is whether it's reluctantness or apprehension dealing with this vaccine. And I think it has to do in large part, and if I could be critical of the scientific community, please allow me to do so. It's been the scientific community's lack of emphasis on increasing diversity amongst its ranks, right? And I'm not just talking about racial diversity. I am talking about racial diversity, but I'm not just talking about racial diversity. I think the biggest gap or the biggest area that we can improve on in regards to increasing representation within the scientific and medical communities are representation from individuals from lower socioeconomic groups. I think that has played a huge role in the apprehension and the reluctantness of individuals in various communities. If you just look at groups in which are really apprehensive or reluctant to take the vaccine or adhere to mask mandates, those are usually groups and communities that don't necessarily have opportunities to advance their career in science or advance their career in medicine. And what happens is you don't have individuals from those communities in those respective professions coming back and saying, hey, this is what we should do, you all. So I think we have paid the price for our lack of equity in regards to scientific and medical training. But my hope is that after seeing the shortcomings of the scientific community and medical community, my hope is that we will redirect a lot of energy and emphasis towards increasing diversity within science and medicine.
You know what? I'm actually happy that you brought that up when we're talking about equity and increasing, scientific medicine and economics, and how economics plays a huge part, especially with COVID. We have seen this where a
Yeah.
lot of Black people have suffered more than others from COVID, right?
Mhm.
And we also have seen environmental, where you live in a HUD area and you have several different mining fields or factories around you that causes you to have, something go down, your immune system shuts down, right? And or there could be diseases that go into the body and go into the child that you may bear, right? So, and I'm happy you said this, because first of all, it was an honor. It was such an honor to see you come out when we did our sleep in Raleigh, with the homeless. You came out and stayed out there with the homeless. We had conversations with the homeless. I think we had a little interruption from the police, but that didn't last long. And then and the fact that you were out there with the homeless, and that I want to go back to what you study when we're talking about the HIV and the AIDS patients, right?
Right.
There is a lot in the community that are homeless right now that sleep outside because they have been affected with HIV and AIDS. But my question to you is, the fact that you came out there to, have conversation with them, how does that help build your thought process, like you just said, of economics and scientific, and why we need equity with science, as well as why do we need to make sure we have this so we won't have a pandemic look like this of more Blacks dying than whites, or other races. So from your scientific level, where do you think you're going to do for, North Carolina as a whole, other than continue to educate? Like, what do you think your step would be as a selfless service person that you are, of how to continue to do this study that we're talking about?
Yeah, I just want to go back and say that opportunity was life-changing. I was just at a poetry lounge on Friday, talking to folks there about, community service and politics. And I told that story. And I remember where we were all sitting there, and Kathy, you were there. And listen, I'm not the bravest person on earth, right? I have to tell you, it had just gotten cold. It was dark. And here you have this kind of like this black steed clopping through the night, just rearing up and screaming in the night. It was honestly, it was terrifying for me. And just seeing, that officer make its rounds and, chase people off of the park. And we all knew that he was coming over to us next. I mean, we just knew it. And so like the anticipation in me was building. I felt like everybody around me was cool, but like, I was like, oh no, what's going to happen? What's going to happen to me? Like, cause honestly, you've been seeing.
We had the back. We the activists. We good. You see me. I was chilling. I was just like,
yeah. But I tell you one thing. When so they left and came back, and it was like two more mounted police officers, and they came to us, and they just kind of clopped, and like menacingly, they were like, "What are y'all doing here?" And I stood up, and I was like, "Excuse me, sir. My name is Dr. Richard Watkins. I'm a candidate for United States Congress. Is there a problem here?" And they were like, man, let's get out of here. Right. I think that demonstrates how service and leadership should really be, right? Because of you, Kathy, you really gave me an opportunity to see what it means to truly be a servant, right? Not bringing the people to you, but going to the people, right? Meeting the people on their time on their terms and on their turf. And when you do that, you get a chance to really walk in someone else's shoes. And that was, I'm telling you, Kathy, that might not have been a big deal for you, but that changed my life. And you were talking about like, what does it mean for science? It actually doesn't have anything to do with me as a scientist. It has something to do with me as a human being. And I am just trying to become a better person, right? And this is something that we should think about regardless of your profession, right? I don't care if you're a police officer, a scientist, somebody in the military profession, whether you're an attorney, right? I now, because of that experience, believe that everybody should take time walking in someone else's shoes, not just like, showing up at like at dinner for the unhoused or whatever, but just really being amongst folks who are not like you. And I mean, I tell you, that's going to forever change me. And I think for the scientific community, I mean, we've got to do more of this, honestly, right? In my experience, my fellow scientists who do an amazing, amazing job at what they do, I think they are going to have to step out from behind the bench, right? And go interact with the communities in which are impacted by their research, right? Here's one more story, right? So my company, the Science Policy Action Network, when I was just trying to get it off the ground, I would go to different trainings for entrepreneurship at UNC Chapel Hill. And one of the things that was told to me is I need to work to recruit board members. And so I would meet with an entrepreneurial coach, and they would tell me that I needed to create some sort of initiatives to attract board members. All right, pause. Let's pause that. You can't tell because I know I need to go to the barbershop, but yeah, the church and the barbershop, the HBCU, right? These are all places that create me, right? And so the barbershop, for example, is so important to me. Like, not only getting my haircut, I mean, the type of confidence that you feel when you get a fresh lineup or a fresh cut, I mean, it's nothing like it. But also the conversations that you have while you're in the chair, it's incredible. It's absolutely incredible. And so I remember sitting in the barbershop, and when folks realize that you're like a scientist, right? They start asking you every question in the world. They're like, take a look at this rash, or you're like, I'm like, oh, I don't know what that is, right? You probably need to go get that checked out. But there's this kind of like this real appreciation for what you were able to do. And especially in science, and especially something as relatable as HIV, people ask you a lot of questions. And, we would sit down, and I would sometimes find myself in the barbershop for like an hour and a half, even though I have long since gotten my haircut, just answering questions, arguing with folks, you name it. If you've ever been to a barbershop, you know what I'm talking about. And I remember we were talking about HIV, answering questions and AIDS and so on and so forth. And I remember one of the barbers said, Richard, why don't you just grab some condoms and throw them in the barbershop? I mean, that seems to make so much sense, right? People are getting their hair cut. They're going to go out and go to the club or whatever. They might as well pick up something to protect themselves. And I was like, yeah, that's a great idea. And no sooner did I said that, did I realize, I didn't know where to get, condoms from. Like, I mean, not for free. I didn't have money to just go out and buy a condom and put them there. And it really, I don't know, it really hit me because I was at the time conducting research in the Center for AIDS Research at UNC Chapel Hill, which is one of the best institutions in the world for HIV research. One of the best institutions in the whole world for HIV research. And here I was knowing that one of the best ways of preventing HIV transmission, the condom, I didn't know where to get it. And I just really felt that, I was really failing, right? Here I am doing all this research, but right outside my lab in the community, we can't do basic things like, providing them with condoms. And so I went and I tried to really figure it out. And I gave the lingerie store, Adam and Eve, a call. And I said, hey, listen, my barbershop needs like some condoms. Do y'all have condoms? And they said,
oh my God.
I'm not joking. This is a real story. They said, yeah, we've got condoms. How many do you need? And I listen, I am not kidding. I had no idea how many to say. I was like, 200. And they're like, okay, a day. And I was like, wait, you can give me 200 condoms a day? And they're like, listen, we can give you as many condoms as you want. And so they started delivering them to my house, right? And I would go and I put them in the barbershop. But then I realized I had way more condoms than I needed. So what I did is I went to every single barbershop in Chapel Hill and put condoms in every single barbershop in Chapel Hill. And then I created a partnership with the Durham County Department of Health and started putting condoms in every barbershop in Durham. And then created a whole campaign around that called the Look Good, Feel Good campaign. And I remember going on Spectrum News and telling them all about this Look Good, Feel Good campaign. And so we were in every barbershop in Chapel Hill, every barbershop in Durham. And we then had our first initiative. And that initiative is what we used to attract our board of directors, which allowed us to become the organization that we are today. And that idea came from the barbershop. And so I say all that to say, science would do much better if scientists kind of stepped outside of what we call that ivory tower and really began to interact with the communities, one. And two, we began to pull folks from every single corner of the state, every single corner of this nation, and get them to be scientists, right? I'm not saying science is for everyone, but I'm saying that there are minds out there that don't have the opportunity, and we as a society pay the price, which is a very costly expense for not providing each and every individual opportunities to advance their career via science. And so that's a really big part to me. And that's something that, quite honestly, the situation at the barbershop and the situation that I experienced with you really drilled and hammered home for me.
Well, we do appreciate you coming out to support us. That was a crazy night, because after you left, it started raining, so it got weird. But we were okay we was okay in our tents. It was cold, it was raining, but we was good in our tents. Okay, we did it.
Good.
So I have a question in the chat.
Yeah.
So it's a comment and a question from Rhonda. She says, as a vaccinated person, she's never caught COVID after being around so many different people that had COVID, right? Mm-hmm. How do we how do we get people, how can we get people to see that the vaccine does help when it comes to COVID? Like, what is the way? Okay, I know how it looks as an activist, right? But how does it look, like you just said, as a scientist, as a doctor, like to convince people that this vaccine does work because we are able to be around people that have COVID? I myself have been around people that have COVID and I have not caught it myself. But how do we convince people to get this vaccine for not only their safety, but but other people's safety. Like, where are we at now with that? Because I mean, it all started off as, okay, you wear your mask. Now they're like, you don't have to wear your mask. Okay, let's get this vaccine. Now we got a booster. Then it's like, oh, you can have the Moderna with the Pfizer. So it's like kind of like a back and forth. And I can kind of relate to it because, you know, I was in Germany and I was there during the measles outbreak and I got a measles shot. And now I can't donate blood because it was during 1985. And they're like, stop, because of that was not FDA approved, yada, yada, yada. But just to make a small point that, you know, I was there during that whole outbreak and I got to see what lockdown really looked like. Cause, you know, having a curfew and wearing a mask and not locked down, like we were really locked down. We couldn't go anywhere. But just to throw that out there, how do we convince people out? Like you already said, okay, go to meet them where they are. You already said, let's go see how it looks, you know, research and everything else. But, you know, a lot of people don't want to be researched. A lot of people just want to know, does this really work? And like, if it really works, can you make sure that it works for the Black people and not white people?
Yeah. So I will tell you that in regards to the vaccine's effectiveness within Black people, it has been very effective. In fact, I would say early on in the pandemic, the group that was experiencing the highest risk of death or just the highest rate of death were Black Americans. But that was only at the initial onset of the pandemic. What we then started to see is that the death rate of Black Americans was pretty stable, as well as Hispanic and Latinx Americans, pretty stable. The group that actually started experiencing the highest rate of death in regards to COVID were white Americans. And I think that's something that is not communicated enough, right? Because we understand how politicized masks and vaccines are. That has an impact on demographics, and it doesn't have the same impact on all demographics because politics doesn't have the same impact on all demographics. So I would say, from the point of view as somebody who has worked specifically with the Black community, specifically through church, for example. So I was a CME coordinator for the COVID response on the Conference of National Black Churches. There was a concentrated effort to make sure that Black Americans had information. I believe we were constantly marketed towards. And then also our vaccine uptake was pretty good. Now, for younger Black Americans, that wasn't always the case, but in general, it was pretty high. And I think what we saw was increased likelihood of wearing masks and increased likelihood of taking the vaccine. And overall, that behavior, resulted in a situation that was better than it could have been. But when we look at the rate of death of white Americans, no demographic has seen such an elevated rate of death throughout the course of the pandemic like white Americans. So to your point of, how do we know the vaccine is working for Black Americans? Well, obviously the proof is in our death rates. The proof is also in regards to the vaccine uptake and the role that different Black organizations have played in that. Overall, when we're just looking at at America as a whole, controlling for social economic factors, the Black community has done really well in regards to vaccine uptake. Always, though, I will say there is always much room for improvement. But contrary to popular belief, we've actually performed pretty well during this pandemic.
Okay, I agree with you on that. I believe when the pandemic first started, I think they were saying it was more Blacks at the time.
It was. So
Okay.
I think what we saw was there are so many health disparities that existed. And when the pandemic first started, those health disparities explain the disparities that we were seeing in death rates. But slowly but surely, behavior started to close that gap. And so behavioral ended up being a huge factor in closing that gap. So early on, disparities did play a huge role. But honestly, due to the work of yourself and many other groups, it wasn't as bad as it could have been, but it was still really bad. So I don't want to mislead the audience and make everyone think it wasn't bad, because it is bad. But if you just wanted to compare demographics, we Black Americans didn't perform the worst during this pandemic, is what I'm trying to say.
Got you. And then I got a question that I just want to make sure. Let's see if you can answer this. So when North Carolina ran out of COVID testing sites,
Okay.
and a lot of Black people were trying, a lot of people of color in different urban areas, put it like that, because this leads to the next question.
Yeah.
Was trying to get access to the rapid tests and the tests and whatever, right? And they couldn't because they were all out of tests. So my question is, do you think, coming from a different perspective, do you think that they limit the number of areas that can receive COVID rapid tests versus this area, or COVID testing over this area? You're limited to this many people, or you may not get tested all at one time. This area is going to get tested more. So the have and have nots, that's the question. And the reason why I asked that is because I'm going into a question that was posted in the chat from Rhonda. So the newly discovered cure for HIV using the stem cell research, what is your opinion on that? And also, how does it get accessible to the normal population? When we're talking about normal population, the disenfranchised, demarginalized population that is not receiving things like this, like COVID testing.
Yeah. All right, so I want to just back up. So through stem cells and different treatments in regards to HIV, we have actually seen an example of an individual cured of HIV a long time ago, and researchers around the world were really trying to figure out exactly what was going on. You had an HIV positive individual. That individual then received a bone marrow transplant. That bone marrow transplant ended up resulting in a cascade of events that ended up curing the individual, right? And so for a long time, people have been trying to figure out exactly how that happened. And it sounds like recently they were able to stumble across the ability to repeat that phenomenon that they saw with the patient in Germany. But I want to stop the conversation there, because what we see is that if you are not rich, and what we see is if you are poor, outcomes are always worse, right? No matter what situation is, if you are poor, it is always worse, right? And the United States, that is particularly an issue, right? So we don't have a cure for anything so long as it's not made available to everyone. If you have a cure that only a billionaire can afford, then you don't have a cure. I have the same feeling regarding
You're getting hype. You're getting hype, Dr. Watkins. No, I'm just fine.
Sorry, you're right, but because it's so frustrating, because it really seems that the way we operate is, listen, if you can't afford it, may God have mercy on your soul. And we're just cool with that, right? But that's unsustainable. That is unsustainable, right? So vaccines, we've seen that if you are wealthy or if you have resources, you got the vaccine first, right? People with access to resources also had access to information that allowed them to go chase down the vaccines wherever they were. So now vaccines are widely available. But there was a time where they were scarce, right? And you had people who were people of means and people of influence. They were able to jump line. They were able to jump in their car, go to other states and get the vaccine. They were able to drive different places within our state to get the vaccine. And it's impossible really to navigate our society effectively if you are poor, because there are very few, or the ones that exist are inadequate for allowing all peoples to really navigate our society. And that is made abundantly clear during a pandemic, where you have to get face mask, or you have to get vaccines, or you have to get tested, or you don't have the kind of job where you are able to work from home, and you have to go deal with people in privilege who may or may not feel the need to wear a mask, right? And so to answer the person in the chat's question, I do fear that early on, these treatments that are coming online are really only going to be initially available to people of higher socioeconomic abilities. But then when the technology advances and becomes better and better, then that technology and that medical innovation will become more widely available to more and more people. And that's what we see with any type of innovation, whether it's sorry.
Oh, wow. He actually came all the way off screen. I don't know what happened. I guess we'll wait until you come back. But that was a good question, Rhonda, and that's one of the greatest questions that we like to ask. How does it look in a disenfranchised, demarginalized community, and all those that don't, like he just said, don't have access to economics to buy the cure for HIV or for AIDS? So that's a good question, and he's back. So whenever he connects, if anybody else has any more questions as well, please put in the chat. But as you were saying, Dr. Watkins, sorry,
I got a phone call and it just turned my Zoom off. I'm so sorry about that. But
oh, you're okay.
I think what we see is when the technology advances to a certain point, it becomes more available to everyone, right? We see that with technologies, whether it's phones, cars, you name it. As the technology becomes more advanced and it's been around for a longer period of time, it becomes more available to a wider range of people. But initially, without support from the government making it available to everyone, it'll only be available to those who can afford it.
Now, I'm happy you said from the government, because we're talking about FDA approval. Is that not correct what you're saying?
Well, so FDA approval is a whole thing onto itself, right? So in order for a company to go through FDA approval, that company has to have enough resources available to it to be able to do clinical trials and all of the steps to receive FDA approval. So yeah, that's a whole different scenario. But once you receive FDA approval, there's still a whole situation of being able to have access to that treatment, to that therapy in general. So those are two completely different things, but both involve a lot of money.
There we go. Money, once again, because we can't separate capitalism from racism. That was Dr. Angela Davis that said that, right? Mm-hmm. So now that we're talking about, we have already addressed how it looks economically for the Black and Brown community. And hopefully after the pandemic that it's able to rebuild, we can rebuild, all communities here coming after this pandemic economical wise, because all communities have actually had distress from this, right? The COVID. Mm-hmm. But my question to you as a scientist and how you're looking on research here in North Carolina and coming from the best ever uh, school, UNC Chapel Hill, on scientific research on
Mhm.
medicine. What is your how do you think it looks for, let's just say, an average 30-year-old, 40-year-old person? Because you did mention that we need more scientists. Are we
Yes.
talking about more Black scientists or just scientists as a whole? Are we talking about more scientists for medicine purposes only, or just for the body, like you are for the immune system and the microbiology that you study? Or are you just saying that we're going to need way more scientists because of the pandemic? Right after this, we're going to need a lot more, and credential scientists versus non-credited, because I think there's some people that's actually working that does not have credits. Am I correct? In the COVID industry, from what I was looking at, there's some people that is going to school and they're still doing research with them, or allowing them to do research on COVID.
What we need everything, right? I just want to say we need way more of everything involved with science, right? So every single group, right? Whether you're overrepresented or underrepresented, right? The scientific community must reflect society, right? It must reflect society, and not just racially, right? Because I want to hammer that home, because also what we end up finding is that when you have underrepresented groups racially represented in the sciences, they are still part of the higher socioeconomic classes and groups. We need every single person. As I used to tell my students when I was back at UNC, right, when they would ask me, well, what's the point of diversity? The point of diversity is you do not know whose mind and imagination holds the cure, the breakthrough, the idea that is going to change our lives. So by allowing certain groups of people to have access to science while not allowing other groups of people to have access to science, you reduce society's ability to create those breakthroughs. So your lack of diversity will reduce your likelihood of finding a solution to the climate crisis. Your lack of diversity will reduce your likelihood of finding a cure to cancer. Your lack of diversity will reduce the likelihood that you'll find some kind of technological breakthrough that we're not even thinking about right now. So I think that's kind of what I'm talking about here. Who do we need? We need teachers. Oh my goodness, we need teachers. And we need to pay them well. We need to pay them well. I think people are pretending to have all these conversations that they care about education, but never do I hear a mumbling word about teachers being paid more, right? And Kathy, I know you hear people talking about teachers getting paid more, but you know the conversations I'm talking about. Well, we don't want this, or we don't want that, or let this, or let that. I'm like, okay, y'all stop all this. We'll have that conversation after we pay our teachers more. So science teachers, better education, better support for public education in general, right? We need to make sure that we address poverty, right? We need to make sure that we have these scientific like outreach initiatives in places other than the Mecklenburg area, the Triad and the Triangle. We need to have them all over the place. Shout out to the North Carolina Science Festival, a one of a kind event in April that has outreach efforts in all 100 counties in North Carolina. Shout out to the North Carolina Science Festival. We need people who are science communicators. We need scientists running for political office. Wink, wink, nod, nod. We need scientists who are only about the bench. We need scientists who are able to create different businesses and companies. We need more of everything. More of everything. I'm sorry. That's just what it's going to take. Y'all know how many problems, you know how many challenges we got out there? I don't think people know all the challenges that we have facing us. And we do not have the scientific and medical workforce that is at the level that we need, right? It's down here. It needs to be up here in regards to just raw numbers. And so we got to invest heavily in that. We got to invest heavily in that at all levels.
I have some comments from one of my favorite, Pamela Carver. She said we need more STEM classes. More STEM classes. And we already reflected upon how that looked for the STEM with the HIV and AIDS cure right now. So my question is to you for North Carolina, like, and you having this whole policy network, what is it that you advocate for with your policy network? Is it just saying, hey, let's get like you just said, let's get more funding for these schools, these teachers, or is it more of a policy of how we can put it into place at the General Assembly or locally on how we can get funds to, you know, just like we just said, more STEM classes, more science, all that? Like, what exactly do your is it a nonprofit?
It is. It's a 501c3.
There you go. Yeah.
We basically just meet the needs of the public. So one of the things that we've done is that we served as consultants on Governor Roy Cooper's inaugural transition. So we were with that, kind of really laying out the scientific landscape of North Carolina. We worked with the North Carolina Science Festival, for example, doing a presentation for kids. That was absolutely amazing. We worked with advocates, right? We were the fiscal sponsors of the second annual Raleigh March for Science. I mean, that's just one thing we did. We've done workshops on the influence of technology and democracy. So it's just really based on need and demand, right? We do research papers. So we mapped out the entire scientific landscape of North Carolina. We are the only organization to have done that. And we are starting to look at Virginia and South Carolina. I mean, nobody does science like NC. I mean, you can't even spell science without NC, but nobody does science like North Carolina. I'm sorry. Nobody does.
You know what? It's just because just because you went to UNC and you're an engineer and you have, you know, your PhD came from UNC. Now I'm just playing. I
mean, North Carolina as a state. I'm not just talking about.
I know. I'm being facetious.
But here's something that a lot of people don't know, right? Here's something a lot of people don't know. This is super interesting, right? And people on the ground might not notice it. So talking politically, right? So North Carolina used to have 13 congressional seats, and now we have 14 congressional seats. And that is due to our increasing population. That population growth is due in large part to two cities, right? There's a lot of cities that are growing, but two cities in particular, Raleigh and Durham, right? Now, the reason why those places are growing is because of Research Triangle Park. Now, when Research Triangle Park was first created, North Carolina was like second to last economically in the country. But then Research Triangle Park was created, and now North Carolina's economy is kind of like middle of the pack. And Research Triangle Park and science in general is responsible for the population growth that we are seeing in North Carolina. So it has revolutionized North Carolina's economy, but we just need to make sure that everyone is able to participate in that economy. Because as it stands right now, it leaves out about 85 to 90% of North Carolina out of this present day economy that will only become more and more essential as the years go on. And so that's why I'm so adamant about creating opportunities, because this new economy that we've created in North Carolina, we need to make sure that North Carolinians are able to participate in it. And like I said, as it stands right now, we leave so many people out of that economy.
Yeah, just like expanding Medicare and Medicaid, like Miss Pamela Carver said, you know, let's $15 an hour, right? Free education, free tuition, right? It's free tuition, like all of that plays a huge part.
Cancel student loan debt.
Yes, all that plays a huge part in what you're talking about, and how people can actually go to the school that you went to or go to Fayetteville State and study this type of science, right? Now that we're talking about more of how this may look. Let's say about 20, because it's going to take us, like I said earlier, like 15 years from now, we'll probably be really trying to get out of this pandemic, right?
Okay. I don't know.
However, economically, it's going to be very hard, especially if we don't have the scientists, right? Like you just
Right.
said, if we
Right.
don't have the technology, the engineering, the math, the STEMs, and all that to understand how COVID works, so we can stop it and, make sure we have it, mitigating the risks and actually having the actual tools ahead of time.
Yeah.
For you as a scientist, how do you think that it will reflect upon those that are in school now, if they want to continue their schooling for scientist, being a scientist, because they may feel like they're overwhelmed with, who's saying this, the who's saying this, you got CDC saying that. They may feel like they don't want to continue, because they may be looked upon, as researchers, as experimental people trying to work on people. So how do you think, have you had any opinions from any students right now from UNC to say how they feel as they're continuing to study their science?
Yeah, so when I was at UNC, I felt that a lot of students felt so much stuff was going on in the world that their studies began to lose their importance, right? I would hear students say, why am I busting my tail to get A's in all these classes when the adults who are in positions of power making decisions now seem to, at every given opportunity, drop the ball, right? Well, oh, I'm doing all this and I'm watching, George Floyd. I'm doing all this and I'm watching the pandemic run amok. I'm doing all this and I'm watching people storm the Capitol on January 6th. It becomes very, very difficult for people to understand how what they're trying to do even matters. Right. And I can understand that, honestly. I can really understand that and empathize with that feeling, right? And that's that feeling of like despair and hopelessness, and a world that seems to be rapidly going in the wrong direction. And what I used to say to them is the same thing that I say to people now that I meet, in the community or, on the campaign trail or anything. And, I was like, I can't ever lose hope because you're here, right? I think when we always look for, all the bad that's going on, sometimes we overlook the good that's right in front of us, right? There are people that are, working day and night, trying to be that change, right? There are people like you, Kathy. I know that we do live in a world that seems to just not care about you if you don't have money, right? But there are people like you who invite somebody like me to come and spend a night with some absolutely amazing people that changed my life forever, right? And there are many of us, right? And I think we have been conditioned to not recognize, our greatness, not recognize our efforts, not recognize our contributions to society, because it's very easy to think like, oh, all the things that I've done, they don't matter, they don't amount to anything. But I guarantee you, if you were not here, if you were not doing the work that you were doing, it would be worse. And so I cannot lose hope because I'm still here. And I cannot lose hope because I am able to be here with you. And that's what I tell students all the time. That's what I tell people all the time. Because, that's just the truth. So anyway, I don't even know if that answers your question.
That answered a lot, actually. And it actually answered a lot. And it was very, very inspirational. What you just said, because we need to look for that in a Black community as we're trying to go past this COVID pandemic.
Right.
And as a community as a whole, as humanity, I mean, we're fighting for our lives, we're fighting for us to even live, every day that we go outside, it's like a fight, it's like a battle, and it's not even a battle of, can I go to work and be okay at work because of active shooter, but it's a battle of can I go to work and not get COVID and bring it back to my family, right?
Right. You
And
know,
that
regular
is
people have
people.
become public health experts.
Yeah.
Like stewardess at a church now has become a public health expert. Like, what's the Black community doing? They are doing an absolutely amazing job. I think, given the shortcomings of our medical leadership and our medical infrastructure, the Black churches, the HBCUs, I mean, they have really kind of risen to the top and have really, answered the call. And I think it is easy for us to overlook our own efforts, right? But at least right now, allow me to give folks their flowers, right? The work that many of you have done out there, even though your efforts have been met with absolutely zero gratitude and appreciation, allow me to say that in the grand scheme of things, when we look back during our time on this earth, or we look back in the history books, your efforts saved the lives of millions. And I think it's really easy to kind of overlook that when you see about a million have died, right? Yeah. The work of you, Kathy, the work of so many other people have saved millions and millions and millions of lives. And that's just incredible.
Well, I think your work when it comes to your nonprofit is very, very valuable to the community, especially right now. I think that we overlook, and like you just said, scientists, as we continue to now, everybody's like, oh, scientists, we need them. Before it was like, nah, we're good,
Right.
we'll figure it out. We'll just throw some experimental stuff out there, some pills or whatever, and we'll see how it comes back. But
Yeah.
now, now that we're moving forward into technology, moving in forward into the future of, digital age and digital level, where we're just trying to get and catch up with other countries because we're behind. Um, you know, I just want to give a shout out to you because of the work that you do. The work that you do, not only, your regular day job, but also to go and teach at the school, still go mentor that scientist, and still have your nonprofit to assist in uplifting the youth to say, hey, I know this is a struggle. This doesn't look well right now, like you just said, but we have to have hope. We have to continue to do this because you could save lives. And you're absolutely right. You
Yeah.
can save lives.
Absolutely.
Every day, we must look at it as who did we help and who did we try to help.
There we
Because
go.
if we don't, then humanity, we ain't got nothing. Because we have to live off each other and we have to live together and we have to fight for our lives together.
There we
And
go.
I just want to thank you, Dr. Watkins, for taking your time out and coming here tonight on Fayetteville PACT Live and giving us a lot of emphasis on how we'll look as a community for COVID, and also how it looks for your policy network, which I did put in the chat, that
Thank you.
people can reach you at. And uplift that because we need that. I had my son come to me when he was like 7 years old and say he wanted to be a scientist, and then of course 3 years later he said he wanted to be a football player, and then 2 years later now he's saying he wants to go back to being a scientist. But I just say that because I do know some doctors. I have a lot of friends that are doctors at different places like Washington State,
Uh-huh.
Washington D.C. I actually have a friend of mine that work at Johnson and Johnson. So I mean, there's a lot of people that I know too that be like, hey, at the end of the day, I'm gonna have to keep doing this, but wee
Yeah.
hours of the night, 6 o'clock in the morning, some rest at all. Especially my friend in Washington State for Johnson and Johnson, like she literally
Yeah.
got sleep when all it started. But
Yeah.
just to make it, known that, there's people out there that's, working as hard as we are, as activists out in the street, but they're, trying to find ways to cure people and trying to find ways to help, make sure that people still can live. So I do
Absolutely.
appreciate your time and thank you for making us look at it how it looks in 10, 15 years from now in the Black communities after the pandemic and our Black History series. We thank you from Fayetteville PACT. And we also thank the people in the chat for coming, as well as looking at our series on, vaccines and how it look in the Black community. Is there anything that you would like to leave everyone with? Because we are a nonpartisan organization, so we can't discuss the campaign stuff, but you can do something nice with them.
No, it's all good. You all can the Science Policy Action Network's website. Make sure you follow me on Richard L. Watkins on Facebook. But I would leave with just this one thing. It is nothing to do with politics. But for anybody out there who has like a son that Kathy just described, who's like science, football, science, I'll say this: do both. Just do both. I played football.
You're only saying that because you play football. See, I knew you was gonna say that.
Do
both.
Right back to do both. Do both. Listen, you can do it all. Don't let anybody try to put you in a box, right? You can do it all. You want to do art. You want to be a scientist. You want to play football. Do it all.
I remember when I first met you, Dr. Watkins. I remember when I first met you, and the first thing you said to me, "Well, you know what? When I was getting my undergrad degree, I played football the whole time." I was like, "Okay, that's interesting."
I did. I wasn't. I was lucky. I don't think I was that good. I was able to play football with great players. I was mediocre, but it was an absolutely amazing opportunity. But Leah, I tell students that all the time. Like, I'm like, nah, man, do it both. If you want to play the saxophone and become an attorney, do both of them. Do both. Life is too short. People are too talented. People have dreams. Follow those dreams. Don't let nobody put you in a box. Do it all.
Thank you, Dr. Watkins. And we say it's Fayetteville PACT as well. We uplift all communities, disenfranchised, demarginalized, to, hey, keep moving, keep your dream going, and we'll help you fight that dream, because we believe that you matter, everyone matters. So at the end of the day, that's all that we think of. And thank you for joining Fayetteville PACT tonight, and y'all have a wonderful evening. We have ended our Black History series, and please continue to watch our page as we continue to fight for justice for Jason Walker here in Fayetteville. Today was a 52nd day. We had some people out there today. So we are continuing to fight that for justice for Jason Walker and his family. And we'll continue to fight for racial disparities across North Carolina and as well as national. So please tune in to Fayetteville PACT and continue to watch our work. And without you, we won't be able to do this work. So come on and join us. Come on and join us. Thank you.
Thank you all. Good night.
Yeah, we have stopped.